Hello and welcome. Today we're diving into a complex and often misunderstood condition, bipolar disorder. This nervous system disease significantly impacts mood, energy, and the ability to function. Join us as we explore its causes, symptoms, and the path to managing this challenging illness. The exact cause of bipolar disorder remains a puzzle, but researchers believe it arises from a combination of factors. Genetics play a significant role, meaning that having a family history of bipolar disorder increases your risk. However, genes alone don't tell the whole story. Brain structure and function also appear to be involved, with studies showing differences in the size and activity of certain brain regions. Finally, environmental factors, such as severe stress, trauma, or substance abuse, can trigger episodes or worsen the condition in susceptible individuals. At a cellular level, bipolar disorder is associated with imbalances in brain chemistry. Neurotransmitters, the chemical messengers that allow brain cells to communicate, are thought to be dysregulated. Specifically, the levels of serotonin, norepinephrine, and dopamine, which play a crucial role in regulating mood, energy, and motivation, can fluctuate dramatically. This chemical imbalance disrupts the normal functioning of neural circuits involved in emotional regulation, leading to the extreme mood swings characteristic of the disorder. It's like a thermostat that's stuck, unable to maintain a stable temperature. Bipolar disorder affects people worldwide, regardless of race, ethnicity, or socioeconomic status. Epidemiological studies estimate that around 1% to 3% of adults experience bipolar disorder at some point in their lives. While it can emerge at any age, typically manifests in late adolescence or early adulthood, often between the ages of 15 and 25. Both men and women are equally likely to be diagnosed with the condition. The hallmark of bipolar disorder is experiencing extreme mood swings. These swings alternate between periods of intense highs, known as mania or hypomania, and periods of profound lows, or depression. During a manic episode, individuals may feel euphoric, energetic, and irritable. They may have racing thoughts, engage in risky behaviors, and experience an inflated sense of self-importance. Conversely, during a depressive episode, individuals may feel sad, hopeless, and lose interest in activities they once enjoyed. They may experience fatigue, difficulty concentrating, and changes in appetite or sleep patterns. It's important to remember that these symptoms can vary in severity and duration from person to person. Diagnosing bipolar disorder requires a thorough psychiatric evaluation. A mental health professional will assess the individual's symptoms, personal history, and family history. They may also conduct a physical exam and order lab tests to rule out other medical conditions that could be causing similar symptoms. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, provides specific criteria for diagnosing bipolar disorder, based on the presence and duration of manic, hypomanic, and depressive episodes. It's a process that requires careful observation and expertise. Bipolar disorder isn't a single entity. It encompasses different types, primarily distinguished by the pattern of mood episodes. Bipolar disorder is characterized by at least one manic episode, which may be preceded or followed by hypomanic or major depressive episodes. Bipolar II disorder, on the other hand, involves at least one hypomanic episode and at least one major depressive episode, but never a full-blown manic episode. Cyclothemic disorder is a milder form of bipolar disorder, characterized by numerous periods of hypomanic symptoms and numerous periods of depressive symptoms, which are less severe than those experienced in major depressive episodes. While there's no cure for bipolar disorder, it can be effectively managed with a combination of treatments. Medication is often the cornerstone of treatment, with mood stabilizers, antipsychotics, and antidepressants being commonly prescribed. Psychotherapy, such as cognitive behavioral therapy or family-focused therapy, can help individuals develop coping strategies, manage stress, and improve their relationships. Lifestyle changes, such as maintaining a regular sleep schedule, eating a healthy diet, and avoiding alcohol and drugs, can also play a vital role in managing symptoms. It's a collaborative effort between the individual and their treatment team. Currently, there's no known way to definitively prevent bipolar disorder. However, there are steps that can be taken to reduce the risk of developing the condition or to minimize its impact. These include seeking early intervention for mental health concerns, managing stress effectively, and avoiding substance abuse. For individuals with a family history of bipolar disorder, genetic counseling may be beneficial. Promoting mental health awareness and reducing stigma can also encourage individuals to seek help sooner, which can improve their long-term outcomes. The prognosis for bipolar disorder varies depending on several factors, including the severity of the illness, the individual's adherence to treatment, and the availability of support. With proper treatment and management, many individuals with bipolar disorder can lead fulfilling and productive lives, Recent research is focused on identifying specific genes and brain circuits involved in the disorder, as well as developing new and more effective treatments. Neuroimaging techniques are providing insights into the brain changes associated with bipolar disorder, while genetic studies are paving the way for personalized medicine. These advancements hold promise for improving the lives of individuals living with this challenging condition.